Hi buddies, welcome back to another video. I know, hey, I've been gone, like it has been long. I'm sure it has been like 3 weeks now, but I'm back with another video. Sorry for being too long gone, but things needed to be done. I needed to be busy. I needed to sort things out. So, but I'm back. And I'm back with lashes this time. Any case, buddies, I thank you so much also for the love and support that I've been getting from you guys. And we have grown. Actually, I am super grateful that we have grown. And like, it's just fun. It's just, I'm so blessed, guys. So in today's video, I'm gonna talk about breast cancer. I've been meaning to do this video in October already, because also it was breast cancer awareness, and so but the thing is I never got time to do it in October, but I was like, you know what, rather now than never, and rather let me just do it and get it out there. So yeah, we're gonna learn more about breast cancer today, and at the end of the video I'm gonna show you guys how you can self-examine yourself when it comes to your boobies. Alright buddies, let's get straight into this video. Also, please don't forget to like, comment, and subscribe, and yeah, invite your other friends to come and join this family because it is fun, it is nice, it is everything and more. Alright buddies, so actually what is breast cancer? So I'm gonna just put it in simple terms so that you will understand it. I won't use any medical terms. So breast cancer is a disease in which cells in the breast grow out of control like any other cancer. And there are different kinds of breast cancer, so it depends in actually which cell in the breast turned into cancer. So breast cancer can begin in different parts of the breast. So it is important to know that a breast has 3 parts, right? So I'll insert just a picture of maybe here of a breast so that you guys can see what I actually mean. So as I said, that it has like different parts. So it's 3 parts, which is the lobule, which is a gland that produces milk, and a duct, which is it transports actually milk to the nipple. And lastly we have the connective tissue. The connective tissue consists of fibers and fatty tissue that actually holds or surround everything. So it's surrounded, and it's like it's a membrane, so it holds everything together, right? So most cancers mostly begin in the lobule and also in the duct, right? So yeah, so now what are actually the symptoms of cancer, right? Of breast cancer. The symptoms of actually breast cancer is pain in the nipple, and also redness or swollen lymph nodes, mostly on your axillary lymph nodes and some of here, and also a skin dimpling. If you see any skin dimpling, changes in size, like you see that this size is really big. Obviously all our breasts are, as most of our breasts are asymmetric, but it shouldn't be like a huge difference, you see. And also discharge in your breast. So usually the discharge that you're gonna have if you're breastfeeding, it's understandable that you will have discharge, but when the discharge now is bloody, then there's something wrong. Obviously if there's also lumps in your breast, then there's also a problem. And also a pain in the nipple area, which is sometimes, yeah, meaning that you're going to your periods, but if it's like a consistent thing, then it should be you should be concerned, or consult rather your doctor, right? And yeah, that's all. Nipple discharge, I did say lump, inverted nipple, discomfort in breast. I know sometimes all of these symptoms maybe like states that you are soon going to your periods or something, but some of them you really should know that, no, you know what, this one is really not fine, right? So yeah, or any actually a thing that you actually don't get about your breast, you should actually consult your doctor, right? So, who is actually at risk of developing breast cancer? So, uh, it is important to note that not every risk factor will determine that you will have breast cancer, because some patients do not have actually breast cancer even though they do have the risk factor, and also the risk factor doesn't always have the same effect. So genetic mutation also increases your chances, and also if you have a family history of breast cancer, you are most likely to have breast cancer, and also ovarian cancer. If you have ovarian cancer, you also most likely, and also being just a woman, and being older than 50, most patients who get breast cancer are the ones that are older than 50 actually. And the last one is when you have previous therapy of radiation therapy. So if you had cancer, some sort of cancer, and you had to go through radiation or chemotherapy, then you are most likely, you are actually at risk of getting of getting breast cancer. So, and now how can you prevent it, or how can you reduce the risk of getting breast cancer? So firstly, living a healthy lifestyle, it is very important. Being physically active, do not get lazy, do something gym, actually also when you are overweight, then actually your breast weight obviously become much more bigger. And yeah, and you'll find that sometimes when you exercise or when you lose weight, you will feel sometimes that your breast becomes like more like lighter. You can do a lot of things, because some breasts can be super discomfortable, like like even when especially those patients that have the wearing like D caps and DD, they know exactly how uncomfortable breast are, big breast. And that doesn't mean, as I told you, buddies, that it doesn't mean that you will have breast cancer, but it's just that you are at risk, right? So back to preventing it, obviously having a healthy lifestyle, balanced lifestyle, not being overweight, and also reproductive history. Like, it's important actually to breastfeed your child, so it's very beneficial also to the child and also for yourself, and also if you have like full term your pregnancy, if you have full term pregnancy, then you actually preventing of preventing breast cancer. I know that this one is not your own thing that you can do, but I know, because it might happen that you are you don't have a choice but to have your baby before, so yeah. And also drinking alcohol. I know we don't say don't drink alcohol, but limit your alcohol intake, because in future it can actually increases your chance of getting breast cancer, right? So yeah, buddies, that is it from how to prevent or reduce breast cancer. So now we're gonna get into the part where I'm gonna show you how to self-examine yourself. This you can do every day. It is advisable to do it every day. If you see any changes and everything, make sure to go and consult your doctor. And yeah, just stay because if you don't self-examine yourself like each and every day or every month and everything, when you do feel a lump or something, you won't now know, hurry, is it like was it always there, or did it just develop now in months, or so yeah, it's very important even for your kids from 13 years and up. Make it a thing to examine yourself, even when you moms, for you moms, your child, right? If you have a boy, it is also important to examine their testicles, or teach them actually how to examine their testicles, because also there is testicle cancer, you know. So yeah, firstly, what you need to do, firstly, when you start with the examination, right, you firstly need to inspect your breast, right? So you inspect your breast for any I'm standing here in the mirror. So you inspect your breast of, is there no any discomforts that you're feeling, any sores that you might be seeing, any abnormalities that you might be seeing. And obviously, as I told you, buddies, that be mindful that obviously your breast will not be the same size, so that we may be fine. And also skin dimpling, we've seen a lot of patients with skin dimpling and they thought it was normal, that, and you know, it's not normal. Make sure also the color of your breast is always the same, because you do have a disease where your breast might be orange, like just the lower part of the breast might be orange. So make sure that it's the same. And also the nipples, if they don't have discharge, as I told you, and you don't have any inverted nipples. And also that and when you're standing on the mirror, that you can say, okay, that is fine. So most patients do it usually when you go to bath, right? I feel like that's a very convenient time, because you don't need to take off your clothes. No, because obviously, you know, it's not that you are bathing with your clothes on. Obviously you need to take your clothes off, so that's where you will see that, oh, okay, my breast is still fine and everything. So yeah, so let me show you how you must do this examination. This examination, you can either lay flat, which is what I'm gonna do. I'm gonna lay on bed, and you can also do it while seated, right? So while seated, you need to sit straight. And also, oh, when you examine your breast, also you can actually sit down and also do this, right? So you're just leaning forward, your hands must be flat on your thighs, and that's when you can actually examine your breast carefully, right? So yeah, now I'm gonna show you guys, and I'm gonna be laying in my bed and showing you exactly how you can do it. There's a lot of methods that you can use, but I prefer to use this one because it's simple and easy. Alright, buddies, so now I'm gonna do the examination. So you will use these parts of your hands, right, to examine. And also you can use a pillow, actually put it on your shoulders. But some, I prefer not to use a pillow, because some pillows are like thick, right? So and not everyone has like those soft pillows, right? So but you can do it without a pillow. So your hand actually must be at the back of your head, and make sure that you are relaxed and you start, right? So a pattern that you're gonna form is this one, right? And when you come here, right, then you change, right, then you come all the way up, right? So okay, let's start. So I'm gonna start on the side, right, where actually your breast end, right? So you go gently, 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 gently up, actually where your breast ends, where, like, just underneath your collarbone. Come up, make sure not to miss any spots, right? Miss any spots up until your nipple, right? Obviously now it's not more efficient because I'm wearing my clothes, but I hope you just get the gist of this. Then after, when you come in the middle by your nipple, you turn your hand to here, then you continue down, form that half circle, go up. If you are skinny, you will feel your ribs. And yeah, then you come up, and then fine. If you are done now, you did the gentle one, then you can go again and press even harder, not too hard that you experience any pain, but just the firm one is just to seeing if there's any like smaller nyana lumps or something, right? And then the firm one is just for you to experienced also, it's the same thing, but it's just, you know, sometimes you might miss a thing, because you know a breast is so tricky because it's soft. So when you touch here, maybe if there is a lump here, especially if it's mobile, you can touch here and then it moves, you see. So yeah, then you start again, start this side, go all the way up. Make sure you're looking straight up, not like what I'm doing. Then yeah, your collarbone, then you come, and when you're in the middle of your nipple, you change, and you go all the way down, coming back up, you know. And yeah, take your time when you do this, so that you will just feel that is this really it. If there's something that you can't if there's something that if there's a lump or something, you stop, you make sure actually that this is a lump. You check if it's like movable, or if it's just like them, and also the size of it. But let me not tell you that, because the doctor's actually supposed to know this. But if you feel like there is any abnormality, then just go see your doctor and tell him or her where you've actually touched something abnormal, something, and then yeah. So buddies, thank you so much for watching this video. I hope you guys learned one thing or two from this video, and please do yourself your breast examination each and every day, if not every day, 2 weeks, if not 2 weeks, a month, but make sure that at least a month you have examined yourself. And yeah, till the next time buddies, bye.